would you please introduce yourself and tell us about your background?
Well, I'm a clinical nurse manager in charge of a busy department, pre-operative assessment in a big hospital. I also work as a classical homeopath and have an interest in the Guna products as well. Previously I taught for 5 years at the College of Homeopathy in Tralee.
Do you use homeopathy or any other complementary treatments in your practice?
Yeah, I would use classical homeopathy. Yeah.
Could you talk a little bit about the event you just attended, the Guna Annual Conference on Physiological Regulating Medicine? What you learned, was it interesting, was it useful? What do you think about the method itself?
Well, just briefly, I suppose, I think it's very interesting that there are peer-reviewed articles and published papers demonstrating the mechanism of action, which is a lot of that's been missing from homeopathy, I think, in previous times.
So that is important, the evidence is important.
Yeah, evidence-based medicine is the way to go, really. And it's moving towards integrated medicine as well, which I think is the future.
Is that your own experience, or is that your wish that the medicine should go towards the integrated medicine?
Well, I think a bit of both, really. I think in the current climate, anyway, you can't get away with just giving something because you think it works, or because someone said it works. There's a burden of proof these days if you're to advance and become more widespread and more readily accepted across all the disciplines, really.
So do you see the future for Guna method in everyday conventional medical practice?
Well, I think as the professor demonstrated there are equivalent results using the Guna products without the side effects, so that has to be a way to look at for the future of medicine.
What do you think? A lot of people say it's very innovative, and it is, but a lot of people also say that it takes a major alternation in people's or professionals' minds to actually look at this seriously, at the method seriously. Do you see any blocks, any mental blocks? Do you see any challenges on the way of Guna method, physiological regulated medicine, into the broader kind of medical practice?
Yeah, I think there are plenty of blocks there and plenty of obstacles, but the only way to get through those is through published papers, peer-reviewed in well-known, accepted medical journals, which is what appears to be the case here.
And the last question, did you enjoy the lecture?
I did, enjoyed it very much. I've watched previous podcasts, but actually the advice I would give to people would be to go along. It's actually much better in the flesh, as it were.
Thank you very much. What do you think, just last question, what do you think about the organization, the organization points on the conference?
Sorry, the organisation?
Was it organised well? Were you comfortable? Did we meet your needs?
Yeah, and I think the numbers as they were conducive to questions being asked and had enough time for people. So.
Thank you very much.
Okay, thank you.